Is 6 or 7 months post-op long enough to wait before attempting neck lift revision? I am 4 months post-op neck lift with bad results. My plastic surgeon wants to wait 1 year before he does revision. The submental area is so full it bullfrogs out, and incisions were indiscreetly placed in front of my ears. Still can't cover even with heavy makeup. I can't last a whole year like this. It does feel tingly, swollen from sides of face to underside of my chin where submental is bulging and platysma bands are sagging. Scar tissue also likely. Can I revise safely in 6 to 7 months even if there is swelling?
Thank you for your question. You submitted your question without a photo, and you're asking, is 6 or 7 months post-op long enough to wait before attempting neck lift revision? And you describe in detail several situations you're dealing with. You say you're 4 months after neck lift with, quote, bad results. And your plastic surgeon wants to wait about 1 year before doing any revision. You describe the submental area as bullfrogging out and that the incisions were indiscreetly placed in front of your ears, and you still can't cover these areas with heavy makeup. You also state you can't wait for a whole year, but at the same time you are recognizing that this area feels tingly, swollen from the sides of the face to the underside of your chin where there is bulging and the platysmal bands are sagging. And you are also writing that scar tissue is also likely, and you want to know, is it safe to do a revision at 6 to 7 months even if there is still swelling? Well, in the absence of a physical examination and more details of the history, I can share with you my impressions based on the question you've described so well. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Face and neck lifting procedures are a routine part of my practice and is part of the wide range of services we offer to help our patients with facial aging. So I certainly can share with you my perspective as to what the revision strategy could potentially be given this situation. And let's take it one area at a time. To begin with, it is important to understand that it is rarely of any significant benefit to operate on tissue that is still swollen and actively healing. And certainly there is a little bit of flexibility and in this window, but generally speaking, the optimal time to allow for full wound healing is 1 year. The wound healing process has very specific timeline. But further, with facelifting surgery where the skin is elevated away, a lot of work is done underneath the skin, a certain amount of swelling is part of this process. Yes, people can look good after swelling diminishes, and one of my most dramatic cases was a lady I did her eyelids, upper and lower eyelid surgery and face and neck lift 10 days before her son's wedding, and she looked good, and she was able to, she sent us pictures. But that's something I'm not likely to ever do again, even with the different strategies that I employ to help my patients heal better, heal faster, socially. But at the same time, it is important to recognize that this wound healing process does go on. You're describing tingling, that there is swelling. So at 4 months, that tingling feeling may be a sign of just nerves starting to heal and swelling resolving. So it's a window where you're still dealing with tissue edema or swelling. Now, beyond that, there is this description where the incisions were placed in front of the ears. And the reality with facelifting surgery is that a lot of times, although it is optimal to try to hide the incision just behind the opening of the ear, it's referred to as the tragus, it is often a good strategy to also work with a crease that's already present, or if there's a very significant difference in skin quality between the skin at the ear and in front of the ear, to put an incision in front. Now, if you describe a situation where there is very significant issues with scarring, you might be describing a situation where there's a lot of redness or the scar is getting thickened. Certainly there is management that can be applied in that situation. Management such as the use of steroid injections, the use of lasers, particularly lasers that treat blood vessels to diminish the redness. If you're not able to hide this so well, then you may be able to benefit from something like this. There is also regenerative medicine technology that we have employed to help patients who have come to us with scar issues, and we've used platelet-rich plasma with acellular matrix. There may be some potential benefit there. I think that something that does concern me is in situations like yours where people have come to me for a second opinion, very often where that incision is and the amount of skin that is removed leaves the patient with a relative skin shortage. And a lot of times there isn't room to remove any more skin or to revise that scar. I'm not saying that applies to you, but that is something to be aware of. As far as the under the chin area, in terms of bulging and the platysmal band sagging, it may be that you may have gotten more of a limited face lift instead of a face and neck lift. Now, of course, without the examination, that's just a conjecture. But generally speaking, at the conclusion of a face and neck lift procedure, the neck angle can be really sharp and really beautiful. And essentially the golden rule applies that if it doesn't look good on the table, then it's not going to look good when the patient is out of the operating room. So I would discuss this with your surgeon, whether or not they did a neck lifting procedure where the incision is carried behind the ear to address the sagging skin under the neck. This is what first comes to mind when I read that you had some swelling or quote bullfrogging where there's a lot of extra skin under the neck. It is an area that may not have been initially perceived as being significant enough to address with a more extended neck lift procedure. So I think that I would expect that you went to a plastic surgeon who has extensive experience with facelifting procedures. You know, when people meet with me, they often want to, of course, understand my experience with doing these types of surgeries and the level of expertise, and just get a sense of how comfortable I am with these types of procedures. And I think that more than likely you did the same when you interviewed your doctor. So it is important to at least maintain this dialogue and get your doctor's feedback as to what may be an explanation as to why things have gone in this direction. You know, with a question like this, there is an open question in my mind about whether you have a smoking history, whether there's an issue with diabetes, or whether there's a problem with healing, or were there any complications during the surgery or after the surgery. So if you feel comfortable with this dialogue with your doctor, and if there are details that are still relevant to the way you're healing that can be discussed and a strategy developed with your doctor, then of course revision surgery is going to be appropriate with the same doctor. I think that you have to maintain this rapport and get a sense of of where you are in terms of this process and what can you expect after any revision surgery. I think most of my colleagues who perform facelift, neck lifting surgery will all acknowledge that a lot of times a certain amount of relaxation occurs with any neck lift or facelift procedure because of the elasticity of the skin. But at 4 months, of course, this is not something that is generally typical, and there is a certain amount of healing that still remains to occur. So again, have this dialogue with your doctor, discuss things that you can do short of a full revision operation that can help the healing process, and maybe there can be things that can help you get through this period until revision surgery is performed. So I hope that was helpful. I wish you the best of luck. Thank you for your question.